Hi everyone, I'm Steve. I'm here with Dr. Nario for our weekly little discussion. How you doing, Doctor?
Pretty good. Nice to be here, Steve. So nice to see you back from vacay.
Yeah, okay. So Dr. Nario is at Biointegrative Health Center in Reno, Nevada. You can check them out online and see what kind of treatments they do and all that good stuff. So we're going to talk about MOTS-C, another peptide. You guys, if you listen to the channel, you watch the channel, you know I love peptides. This one has to do with the mitochondria, which is huge. So if you guys like interviews with doctors, nutritionists, personal trainers, subscribe to the channel. If you're interested in our weight loss program, hit the QR code on the screen or the link in the description. You can find out more about that. All right, so this peptide has to do with mitochondria. And first, has this been around for a while?
It has been. It's just that they're getting more use for it just because of course, patients are using it and also studies are being made. So it has an uprise again in the industry.
Yeah, peptides seem to be really popular right now.
Right.
So, how's it administered?
So it's actually subcutaneous. So it's an injectable, and there's so many different ways on how you inject it. And yes, I'll discuss that with you in a bit.
Okay, so that is needle, so it would be subcutaneous, like an insulin needle.
Oh yeah, so it is. It's almost something related to, I mean, any type of. I mean, there are peptides that you do IM, but subcutaneous really is the key. So here's one thing I found out about in a recent peptide conference: microdosing is really the best way to introduce peptides because you're helping your own peptides versus giving a high dose in your system that kind of sometimes suppresses it, right?
So, what's a microdose and what's a larger dose? What is that with this particular peptide?
So, for example, for Mot-C, it's recommended to be given like 4 to 5 milligrams per dose. But if you're going to do, for example, 1 milligram, right? And then you're doing this more often. So it's really, when you're spreading out the dose, you're basically giving your body a chance to make its own. And it's acting more of a support rather than a dose that will be dependent or be dependent by the body on. So it's really just guiding your system with low doses.
Okay, so and that would be administered what, five, six times a week?
Yeah, so MOTS-C is a weird one. There's so many different ways in how recommendations for protocols are, and you would hear that it's given like 10 weeks in a row, and then every third day for 2 weeks. Or there are ones that like Monday, Wednesday, Friday, and scheduled for 4 to 6 weeks. So really, there's so many different ways you can play around with it. The good thing about how you can play around with this is because it's safe. There's not much really bad side effects that you see with MOTS-C. With the side effects, I mean, with the effects that we're going to be talking about in a bit, you're going to see how beneficial it is, even on micro dosing levels.
Okay, so as you guys, you know, you listen to us talk about peptides. A peptide is a short chain of amino acids. That's all. Simple. Short chain of amino acids. So here's
Mhm.
a big question. What does it do?
What is it? Well, so let's define to the audience first what is MOTS-C. So MOTS-C is short for mitochondrial open reading frame of the 12S RNA dash C. So that's why we keep it just MOTS-C. We don't want to confuse everybody here, but that's the reason why it's called that name. It's a mitochondrial-derived peptide. It consists of 16 amino acids, as you said, short ones. And unlike most proteins, as mentioned to you, is from the mitochondria, because majority of the other peptides are nucleus based. They are produced by the nucleus and dependent on the nuclear DNA. But this one is all about the mitochondrial DNA, and that's why it's all about the focus of boosting that DNA function. And yes, and I'll talk to you about the benefits more in a bit.
Okay, so that's my next question. Benefits.
Okay, all right. So the mitochondrial derived peptides actually are related to so many things, but you have to remember the powerhouse is what it builds. So when is the mitochondrial powerhouse being used? A lot in stress, right? So it helps us cope with stress because we use a lot of these and they get destroyed when stress occurs. So it's regenerating when during stressful situations. That's what Mot-C does. It also is an anti-obesity peptide, meaning it relates to the metabolic signaling of the system. It also can delay brain, I guess, defects or progression in terms of memories in relation to the circulation that it can bring to their brain again. People who go through chemo, they also have bad side effects, which destroys their mitochondria. So this helps. Even for pre-insulin, pre-diabetic, yeah, insulin-dependent diabetes, these are also peptides that can be used on them. And there's a lot of, again, fat oxidation, glucose oxidation. And when you talk about experimentation, there are a lot of studies now, but they're more of lab versus human studies. And the lab studies had shown and had been studied on mice, and weight is the one that actually has been seen for them to lose that much when you're using Mot-C, and it increases their energy expenditure, also lowers insulin levels. And one thing that's being used out there is for also anti-aging protocols. You have to remember, Mot-C levels in our bodies decline with age. And when you use Mot-C, it increases intracellular NAD, which again reduces sirtuins that actually leads to more longevity. And it lowers down inflammation, inflammatory cytokines such as TNF alpha 1 or kappa beta that is out there. And yeah, lowers triglycerides, even for osteoporosis, it promotes bone formation. But really, for human studies, there are more studies that supports metabolic problems such as diabetes, obesity, and age-related decline.
Okay, because we're talking about the mitochondria. We're talking about energy, right?
Mhm.
Getting energy, and the mitochondria is the powerhouse of the cell, right?
That's right.
So we're talking about energy going into the cell, which, of course, if you connect the dots, that's going to help diabetes, right? Because it's going to get glucose where it's supposed to be, ATP into the cells. And
Mhm.
so that's how it's working, right? It's
Right.
moving the energy into where your body wants it, into the mitochondria. Am I right?
Yeah, well, good thing you mentioned that. Is because a big part of our audience here are athletes, right? And that's how they utilize MOTS-C because it activates the skeletal muscle to increase AMPK and the glucose transporter, meaning get in the glucose so that the athletes can use more energy. And also, it actually increases the exercise-induced balance that they need to adapt to the stress of exercise and increase their tolerance for more. And you have to remember muscle health. It maintains muscle function. It also maintains for our aging population that are out there. It maintains the mass. And the thing here is, I have personally noticed that it doesn't have much effect in people who are lean, but still, you get the enhanced mitochondrial effect. It doesn't mean that, oh, I have to be a little bigger to use this so I can lose weight. No, even the lean ones, they actually benefit this because of the mitochondrial benefits.
I can tell by what you're saying that describe a little more. This is huge from what you're describing for anti-aging, right?
Mm-hmm. Yep.
Keeping the metabolism functioning better, helping to stave off diabetes or different things like that, and getting the energy. And you said we lose it as we get older. We also lose mitochondria as we get older, right?
That is correct. And then again, when you mentioned about, I guess, aging process, so when we age, we gain more of what we call white fat, right? And of course, the weight that bear the inflammatory content of white adipose tissue is so huge versus brown adipose tissue that actually can be converted. So that's why it actually increased the thermogenic activation of these adipose tissue, which is the brown specifically, to increase weight loss and also produce more energy, as you mentioned, for our aging population, for our athletes. I mean, anybody is actually going to benefit from this.
So it's kind of positioning energy to where it can be used, right?
Right. And that's why you have to remember mitochondria equals energy. So anything that's related to mitochondria is like CoQ10, for example. That's mitochondria. The first thing you think about, oh, mitochondria. It's always about energy and regenerating that mitochondrial function when you've used it so much.
And the mitochondrial function is so involved in the anti-aging, there, right?
Right. That is correct.
All right, so you mentioned something about you were going to get into side effects. Are there side effects with this? Who shouldn't use it?
Yeah, so in relation to side effects, really this is just related to the typical side effect of when you're injecting a medicine, a swelling or possible rash or reaction on the site of insertion or injection. So, but again, rare, very rare. The things that I definitely want to put out there is do not use this later during the day because it actually has the potential to disturb sleep patterns. And because of the energy boost that sometimes it gives like 30 minutes after administration. So again, mitochondria, all about revving it up. And that's why 30 minutes before you keep an eye out for that boost of energy. But overall, very safe. And I myself, I haven't seen a reaction in terms of my patients.
Okay, so who is going to benefit the most from it? You said athletes, people who are pre-diabetic, but does everyone benefit from it the same, or is there certain people that are going to benefit from this more?
So that's the beauty of peptides. The thing here is it adapts. So I think the only one that I kind of put a red mark or red flag on was the lean people who cannot lose any more weight. So the beauty of this is they're not going to lose weight. They're going to enhance their mitochondria even more. So that's why really I cannot say nobody can benefit from this. Of course, the sicker you are, the more pathology you have, you will benefit because it's any illness is related to mitochondrial dysfunction, right? Dementia, diabetes, obesity, all of those are mitochondrial based problems. That's why I myself, I couldn't put a restriction on anybody who wants to use this.
Wow, so I think I heard you kind of say there that someone who's thin, fit, active, and doesn't want to lose weight, if you're more efficient with the energy because of this peptide, you're going to use the energy properly instead of losing weight by wasting energy.
You remind me of a patient, Steve,
I
that
do. I'm trying to
they
be a patient.
no, they wanted to use this because they want to get their abs to come out. You've been working hard to get all that six pack out, but you just can't. But you're already lean. You have a good flat ab. But this one actually helped that purpose. Use Mot-C, six pack came out.
Hmm.
So as you can see, there's no thin person that does not have fat. There's always going to be fat in our bodies. And again, that's normal. It's just that it's not going to put your body fat level in dangerous levels when you use this when you're already lean.
Okay, last question. How do you get it? I'm assuming that you need a prescription. Your doctor has to write you a prescription to get this. You want to make sure it's coming from a reputable
That's right.
pharmaceutical company and all that.
But that's right. There are, again, products in the internet that uses Mot-C, but you have to make sure that your sources are pretty clean. And when you go to direct providers, we definitely know where our sources are and how clean these pharmacies do their sterility checks. So, but again, it's out there, it's in the internet. Just be careful as we impart that to our audiences.
I mean, the best thing is to talk to your doctor and tell them what your
Yeah.
goals are, and or have your doctor refer you to someone who understands this more like you, who can sit down with someone and talk to them about it, right?
Well, it's a good thing you brought that up. The one thing, a caveat here, why Mot-C needs a little bit of a medical supervision before use is because it actually is recommended when you're going to take it, you need to take methylfolate along with it because it depletes your methylfolate. And that's why we need to make sure I check the methylfolate levels, I check homocysteine levels, so that I don't want to drain that out because the whole mitochondrial process revolves around the methyl tetrahydrofolate cycle. And that's why MTHFR gene deletion people, I don't know if you've heard of that condition, they need to be cautious about using this, especially if they're not supplementing.
Okay, so is there anything I should have asked or something that you would want our audience to know about this product that maybe I didn't bring up?
So Mot-C is something that I always suggest. Sure, you can take it when you're a pathology, but really I reserve this a little bit more for healthier patients.
Hmm.
Just because, as I told you, you will optimize more of your mitochondria when pathology is out there. So there's so many things that this peptide can do when you have a cleaner plate. So that I'm not saying you can't use it when pathology is there. It's just more optimal. when you actually have a better landscape to work with.
Very interesting. Okay, well, that's Mot-C, everybody. It's a peptide. You said a chain of 16 amino acids.
That's right, 16.
All right. Well, as always, Dr. Nario, we thank you for being here. We thank you for bringing these different peptides and vitamins, minerals, and treatments to our attention. Thanks for being here.
Well, Steve, thank you again for having me. As we all know that our knowledge is your power to better health. And thank you for letting me provide you with edge on longevity and health maintenance, which I call the biological edge or the bio edge.